Good evening, I'm Dennis Ward. Welcome to APTN National News. We begin in Edmonton, where the police service is being criticized after a video surfaced showing officers removing homeless people from a transit terminal in extreme cold weather. APTN's Chris Stewart has that story.
But you know what? We're under extreme weather. Aren't we under?
Yeah, there's lots of shelters. The city provides for those.
No, but
okay, then off you go.
Judith Gale is a member of the Edmonton chapter of the Bear Clan. On Valentine's evening, her patrol was handing out food and clothing to a group of homeless people who gathered in the warmth of the tunnels of the Edmonton's light rail transit system. 2 Edmonton police officers were there, and Gale says one officer took soup that was just given to one person and threw it out.
He had his belongings out on the ground with him, and the policeman wouldn't even allow him to pick up his belongings, his little belongings that he had. He wouldn't even allow that. He kicked him out immediately.
wow.
After this, Gale began recording with her phone. The officers approached a group of homeless people and told them they had to leave.
Yeah.
At the top of the stairs where you can eat it.
So it is feels like minus 33 out, and EPS has just kicked everybody that was taking shelter and food and clothing from the Bear Clan. And
The city is still under an extreme cold warning. At the time, it was minus 22, and the wind chill made it colder yet, into the minus 30s.
It's an unwritten law. You don't put anybody out on the street in minus 33. You know, that's just ridiculous. The least they could have done was follow the extreme weather protocol and contacted one of the ETS's buses that the mayor designated to drive our brothers and sisters to shelters for the night.
Judith Gale says the police should be spending their time fighting crime, not evicting people looking to stay warm. She wants all officers to take compassionate care training.
That's exactly what we do. Community taking care of community, human being to human being. And I think that's where our strengths lay, and where the EPS strengths lay is fighting organized crime, fighting terrorists, doing work like that, instead of being glorified babysitters for child welfare, instead of, like I said, policing the unhoused.
In a statement, the Edmonton Police Service say their officers strive to enforce the balance of public safety, bylaws, loitering, and COVID-19 protocols. They say the officers should have done a better job at communicating their role in helping connect citizens to the city services to keep people safe and warm. They say they are reaching out to the community to discuss the situation. Edmonton temperatures are beginning to warm, with temperatures expecting to reach +1 on Friday. Chris Stewart, APTN National News, Edmonton.
A sense of relief for First Nation in Manitoba. Over the weekend, Pungazi First Nation flagged 7 cases that might have been the UK variant of the COVID-19 virus. The community sent those samples to the National Microbiology Lab for sequencing. Pungazi announced today that those samples tested shared a genetic marker with the UK variant, but were in fact not the variant. Pimachikamak Cree Nation, also known as Cross Lake, is also awaiting results from the National Microbiology Lab. Pimachikamak flagged 1 case as a potential variant. That community currently has 107 active cases of COVID-19. Manitoba's top health doctor says he does not believe these variants are of any concern.
We haven't had any indication that this is a variant of concern. We've seen this variant in the past here in Manitoba as well. So, as of right now, it does not appear that this is a variant of concern.
In Halifax, Nova Scotia, people gathered on Sunday to march for missing and murdered Indigenous relations. This is the second year for the annual event, and as Angel Moore reports, This year's event drew a larger crowd.
About 200 people marched through downtown Jabuktuk, also known as Halifax, for the first annual Jabuktuk March for Missing and Murdered Indigenous Relations. Grandmother Darlene Gilbert, spirit name Thunderbird Swooping Down Woman of Annapolis Valley First Nation, helped organize the event.
To acknowledge what is happening in Mi'kmaq so that it can be called out on. It's for the benefit of our women, our men, our children.
The march ended at the Halifax Public Gardens for prayers and speeches. Kyra Gilbert, Darlene's daughter, handed out red ribbons.
In hopes that we can all come together and work collaboratively for a better future, of course. As in youth, we all have that kind of view.
The red dresses and ties are in memory of those whose lives were taken. Last June in New Brunswick, Chantal Moore and Rodney Levi were fatally shot by police in separate cases during a wellness check. Darlene says the genocide needs to stop.
The healthcare system needs to be readjusted for Indigenous people, that the RCMP need to be readjusted for Indigenous care, that social services needs to be readjusted for Indigenous matters.
The MMIWG report, released in 2019, has 231 recommendations, and the Government of Canada has been criticized for its lack of action. Kyra is not hopeful.
It scares me to walk out of my door past 9 a.m. and it shouldn't, as a 18-year-old Indigenous youth here on my own land and territory.
The red dresses will be removed in ceremony at a later date. Angel Moore, APTN National News, Jabuktuk, known as Halifax.
Meanwhile, the Prime Minister recently announced help for women during the pandemic. Justin Trudeau announced $100 million to go towards training and programs to address things from unemployment to the health and safety of women in Canada. The Minister for Women and Gender Equality, Miriam Monsef, says Indigenous women will benefit.
It is meant to provide an opening for an Indigenous organization, a nonprofit, a charitable one, public institutions such as post-secondary and municipalities to apply for funds that help create greater health and safety for women, create jobs and retrain and skill up women who've been hardest hit by COVID, and to support and increase the representation of women and diverse leaders around decision-making tables in this crucial time.
Still in Ottawa, Bill C-21 was presented in Parliament today for its first reading. The bill was created to strengthen Canada's firearms laws. Prime Minister Trudeau and several ministers made the announcement, saying the proposed legislation calls for longer prison time for weapons offences. They will also implement a buyback program and increase penalties for weapons smuggling, all to tighten gun control in the country.
In doing so, we will make Canadian women and girls safer. We will make all vulnerable populations, including trans and two-spirited people, racialized Canadians, and Indigenous people in Canada, safer.
Time for a quick break. When we return, we'll kick off a new week of our Perspective series on the human toll of the COVID-19 pandemic. Stick around. Welcome back. Since the pandemic began, APTN National News has brought you the latest updates as the country grapples to contain the COVID-19 virus. APTN's Tina House has this Perspective series on the human impacts of COVID. Here's part one of COVID in the community.
I'm not even eating. I can't hold anything down. Sucks. I wish I took COVID serious. I was dumb. This is the worst sickness ever.
The It's now 2021, and COVID-19 is everywhere. This song, called Alone Together, by Vancouver-based singer-songwriter Ivan Vladakovic, is a powerful reminder of how much COVID-19 has changed all of our lives.
Caught us by surprise, the world changed overnight. It's fear with the unknown, together, not alone. Some enjoy the time, others struggle to survive. We'll make it if we're strong, together, not alone. Oh, you're not alone, we're in this together.
Since the pandemic started in March of 2020, over 110 million people have become infected with COVID-19 globally. 84 million of those people have recovered, but over 2.4 million people have died. New variants of the coronavirus are also emerging, with studies showing that they are more contagious and possibly deadlier than the original virus. The lockdown also meant countless businesses were shut down. Millions of people have lost their jobs, and many have struggled with their mental health from the isolation in quarantine.
We have to reach a point where we're in control of the virus. The virus is not in control of us.
One of those hardest hit countries is the United States. With 28 million positive cases and 18 million people recovered, the death toll in that country is nearly 500,000 people in less than a year, bypassing those killed during World War II in 6 years of battle.
It's not a joke. I don't know what more or how much more I could express.
Sarah Montoya, a 43-year-old mother of 3 daughters from El Paso, Texas, posted this video to Facebook on July the 5th, 2020.
Please do not put your families at risk. I did the best that I thought I could. It is not worth it. Put your masks on. Don't go out if you don't have to.
Montoya died from COVID-19 on August the 19th, 2020. This was her last Facebook post. Stories like this are all too common as the world struggles to combat COVID-19. And how exactly does COVID-19 spread? It can start with something as simple as a sneeze from someone who is positive. Minute fragments of droplets can then land on the nose or mouth of another person. Once the extremely contagious coronavirus enters your body, it starts to attack cells to reproduce. The virus has protein spikes that look like crowns. They find a receptor molecule of a healthy cell and fit in like a key. It then begins programming that cell to make new viruses. Once that happens, it starts attacking mostly your throat and lungs, and in some cases, people develop pneumonia. Eventually, the body starts to attack itself, and in some cases, leads to death.
Social distancing, physical distancing, is the single best way to keep the people around you safe. What does that mean? It means keeping 2 meters between yourself and someone else. It means avoiding groups. It means staying home as much as possible.
829,468 Canadians have contracted COVID-19 since the pandemic began, with 773,330 that have recovered. There have been 21,354 deaths. 19,068 Indigenous people were confirmed positive for COVID-19. 17,380 have recovered, and 204 people have died across Canada. Experts like Dr. Teresa Tam says it's vital we hold the line in terms of safety measures.
A window to flatten the curve of the epidemic is narrow. We all need to act now.
76-year-old Robert Yelton is a master carver from the Squamish Nation. Here he is a few years ago at the totem pole he carved for his late mother. In early December 2020, he tested positive with COVID-19 and agreed to share his story from his hospital bed.
In the beginning, it started out like the flu. I thought it was just a flu the first week, and then I couldn't eat nothing. And then the second week, I thought it went away. It came back. It was just terrible, and I never got to eat again. And then the third week, now I got no energy, and it just kept going, and I got so weak I couldn't even stand up.
On top of having COVID-19, doctors have also discovered Yelton is battling a second virus called Giardia. That's making it hard to keep anything down. He says it's been 25 days since he's had anything to eat, with just fluids keeping him alive. Robert says he was careful and remained isolated for 10 months since the beginning of the pandemic. But after the BC government loosened some of the restrictions, he let his guard down and met a friend for coffee at the mall. That's when he thinks how he might have been exposed. He says it's the sickest he has ever felt, but he's thankful he never had to be intubated like others.
It went after my heart. I got a stent in my heart, and it also goes after your liver, your kidneys.
Yelton used to love to ride everywhere on his scooter, but after he went into the hospital with COVID-19, he says he couldn't stand for more than 30 seconds. But slowly, he's getting stronger and trying to build up his appetite.
I'm hoping that maybe that chicken noodle soup will come taste good tonight.
Dr. John Boyd is a critical care doctor at Vancouver's St. Paul's Hospital. He says they are still learning so much about COVID-19 every day.
March, April, and maybe early May, we were seeing mostly travelers. We were seeing people who were older, in their 70s and 80s. And then starting in September, we had a lot of patients here at St. Paul's. We were running 11, 12 patients in the ICU on ventilators and so on, and maybe triple or 4 times that on the ward. We're seeing them younger.
Robert Clifton was one of those who started to not feel well last September. Once a very gregarious and social person who loved to entertain friends and family before the pandemic, he says despite his best efforts to stay safe, he also contracted COVID-19.
It's strange as to where I could have gotten it. I was doing all the right things of doing online shopping, not going out to restaurants, not going into crowded spaces.
It's still a mystery why COVID-19 affects people differently. Some people can be asymptomatic, where they show no symptoms but can still be a carrier. Others only get mild symptoms. But then there's people like Robert Clifton who get severe symptoms.
I was completely bedridden for actually 20 days. The typical isolation period is 10 days. And they kept me in isolation for 20 days because my symptoms were not rectifying. I dropped 20 pounds in 2 weeks and was having difficulty keeping anything down. And at one point, I was having difficulty breathing and my resting heart rate was over 140 beats a minute.
Clifton says he also had unusual symptoms in his arms and hands.
The sensation that was going on down my arms, the burning sensation in my palms, felt like I had flamethrowers at the end of my hands, and it was really uncomfortable feeling for me, and it lasted probably about 2 weeks. You know, the stuff that I reported to the health authority and stuff, they hadn't really heard of before.
Shortly after we filmed this segment, there was an outbreak at St. Paul's Hospital, with 3 wards shut down, including the cardiac intensive care unit. In part 2 of COVID in the Community, we hear from those that don't believe in the pandemic. And then we take you inside a COVID ward where healthcare workers on the front lines are working every day to save lives. That's coming up tomorrow on APTN National News.
Harrowing stories there, and as Tina mentioned, we'll have part 2 of her Perspective series, COVID in the Community, tomorrow. Time for one more quick break, but stick around. There's more to come. Welcome back. Time now for our photo of the day. And this one's from Malaya Karnik Chapman and Etua Snowball. Were able to provide for friends and family after a successful caribou hunt. Stay safe and stay warm. You can keep those pictures coming by sending your pictures to share@aptn.ca. Time now to take a look at tomorrow's weather forecast. Starting on the east coast, -2 in Halifax, +4 with showers for St. John's. 15 below in Nain, -19 in Kuujjuaq. 16 below for Chibougamau, -11 in Val-d'Or. -7 and sunny in Ottawa. Partly cloudy and -7 for Sault Ste. Marie. Sunny and -18 in Thunder Bay, -8 with snow in Wawa. -27 in Thompson, God's Lake, and La Pas. -26 for Winnipeg, -15 in Dauphin. Snow and 16 below for Regina. Snow and -18 for Saskatoon. Flurries and -19 in Meadow Lake, -15 for Uranium City. Over in northern Alberta, sunny and 15 below for Peace River. Snow and -17 for Fort Mac. -5 in Calgary and Lethbridge. 12 below for Edmonton. +5 in Vancouver. 6 above in Victoria. -3 in Prince George and Smithers. 20 below for Fort Nelson. -24 with snow in Old Crow. Flurries and 11 below in Whitehorse. Snow and -24 for Yellowknife. -14 in Fort Liard. 26 below for Sax Harbor and Inuvik. Snow and -21 in Colville Lake. -33 for Baker Lake. 27 below in Cambridge Bay. -36 in Igloolik and Arctic Bay. The long-term impacts of racism in the healthcare system are among the reasons some Indigenous people are hesitant to get the vaccine for COVID-19. That's according to Dr. Marcia Anderson, a medical officer of health for Indigenous Services Canada in Manitoba, and our guest tonight on Face to Face.
Some concerns that have been raised around past experiences with medical experimentation without consent on First Nations people, which of course also would be a form of racism, and the concern that this vaccine was approved very quickly and maybe we're being experimented on again. And I want to assure people that that's not the case. There have been rigorous studies and approval processes that have been gone through, but these are the long-term impacts that experiences of racism in healthcare do have that are impacting the COVID pandemic.
And that episode's less than 2 minutes away. That is all the time we have for your APTN National News for this Tuesday. I'm Dennis Ward. Thanks for tuning in. Have a great night.